Hi, good morning, everyone. We are meeting on 31st May 2025 for a very important session on importance of vaccination in children. Uh, this is, I think, a topic which all parents would need. And to talk about this topic, we have Dr. Parvinder Singh Narang. He is highly respectable pediatrician with over 4 decades of experience in children healthcare. He's currently served as a head and director for pediatrics in Max Super Specialty Hospital in Delhi. He's graduated from Maulana Azad Medical College in 1974 as MBBS. Dr. Narang has earned prestigious qualifications including MRCP from Royal College of London. He's the author for 10 books on children health in English and Hindi and held several prominent positions, including president of IAP Delhi 2013-14, executive member of IAP Infectious Disease Chapter 17 and 18, as a president of Sevra Rehabilitation Institute of Children with Special Needs. He is deeply involved in supporting children with special and mental challenge. Dr. Narang is also a regular contributor to NDTV, Republic TV, and other media platforms. Sir, we are blessed to have you here. Over to you.
Thank you, Saurabh. And today, as you said, the topic is importance of vaccine in children, and I hope I will be able to deliver this in a very precise way. We all know there are many threats to global health, and the three threats I'm going to highlight today are the global COVID and influenza pandemic and leading antimicrobial resistance by overusages of antibiotics. And the most important is vaccine hesitancy. Dear friends, vaccine lies in the fridge. Once it goes into it is called vaccination. So my main focus will be how to give vaccine to vaccination. And in fact, once you vaccinate, obviously lots of challenges of infection comes down, and so comes down the antimicrobial use, and so comes down the antimicrobial resistance. There are hardly any antibiotics in the pipeline in development because uh, as soon as the antibiotics comes, sooner they get resistance, and we are going to be in a very vulnerable situation very soon if we do not combat the infection in a better manner. Well, we all know the three layers of protection: the external protection and the internal protection. The external protection we can do by a very good hygiene. We can avoid infection by using the mask, and we can avoid the public places once you have infection, and we can break the chain of spread of infection. But what we also need is a internal protection of our body, and that internal protection comes with three things. One is the nutrition status, and the nutrition status makes you immunocompetent and your body's ability to fight infection. And once the nutrition status gets affected, the immunocompetence comes down, the various deficiencies brings suppression of the immunity, decreases the antibody response, decreases various and makes the dysregulation of the host. That we observed during COVID, that all those who had the nutrition deficiencies, they had a very cascade kind of a inflammatory response, leading on to the spread of infection and leading on to the severity of infection. So keeping this triad is very, very important, that you break the this triad and you avoid the infection and you have a better immunity for uh, fighting the infection. So these are the various small things which probably we can talk sometime later regarding various immunomodulators, because we need. And here I want to say the children have a very good innate immunity. In fact, during some of the infection, even before the antibodies come, they fight the infection right at the uh, level, and then develops a very protective response from their body by the form of innate immunity. And today I will pledge against that the UNICEF 1000 days, which are 2 years of 365 days and 270 days of pregnancy, that we need to bring to all our children optimum health, a good growth, good immunity, and leading on to good neurodevelopment across their lifespan. So these first 1000 days of life are very important. In fact, I can add that even before the uh, pregnancy, if the would be mother has a good nutrition and is vaccinated against various full vaccination against pertussis, influenza, and RSV, then her pregnancy can be very, very good, and a good nutrition gives a good, healthy child. And across, we have seen that once the child is healthy, the neurodevelopment across the whole lifespan is very good. So, friends, today my presentation will outline some history. And as I said, vaccine to vaccination, this opposition to vaccine even started when the first vaccine was developed by Edward Jenner. And we all pediatricians, we all doctors, we all vaccinologists must combat this misinformation, because vaccines have achieved a lot, and recent developments, current roadblock, and the future prospects are very good for the vaccines, provided we have a good road to health and we follow all the steps. Well, as I said, Edward Jenner, a country doctor in Gloucestershire, and his successor, who have shown that infectious disease can be prevented by artificially inducing immunity through the administration of vaccine. Historically, if you say the vaccine development probably was in 1774, there was a village in Dorset where the milkmaids uh, never used to get the smallpox, or used to get smallpox less, with less facial skin involvement. And Jesty, who was a cowman, observed that probably the cowpox has some immunity to the smallpox, and he vaccinated his wife and his two children, and did this bold experiment, and which hypothesis was a practice of vaccination. And these are the beautiful girls of Dorset village, which never used to have scars on their faces, because they used to get cowpox disease early in their life. So avoid cowpox has a immunity to smallpox. And Edward Jenner vaccinating children, but lot of resistance again from public. Some were happy, some were not happy, and even Chinese practice this crude method of transferring germs, heating the germs, making this killed vaccine and injecting into the skin by needles and probes. So, friends, uh, 1890, Edward Jenner and Louis Pasteur were able to develop 33 vaccines by 1890. including vaccine for typhoid and cholera. And to honor the memory of Edward Jenner, the word vaccine came from vacca, which is cow in Latin, which was coined by Louis Pasteur, who established the vaccine, and it is called vaccine. And he was also one of the developer for the rabies vaccine. So by 1890, there were 33 vaccines already available for that. What vaccination has achieved so far? Nothing to hide, smallpox totally eradicated. Poliomyelitis almost at the verge of being eradicated. Measles almost eliminated in many developed countries, including America, but still occasional cases of measles come up, and various developed countries have controlled diphtheria, pertussis, tetanus, rubella, Haemophilus influenza, and various other diseases. Hepatitis B in Taiwan and hepatitis A in Israel. Hepatitis A was the first used in Israel in the national schedule, and they were able to eliminate hepatitis A. And lots of success by using various pneumococcal vaccines, rota vaccines, meningococcal vaccines. Almost disease are partly or completely controlled in many countries where we have achieved this. Well, why vaccine to vaccination there is a problem? A natural history of vaccination program, and we all observed that during COVID, the moment the first vaccine came, usually the vaccine takes 10 to 15 years to be developed, tested, and do all the trials. But we all know the COVID vaccine came much faster, avoiding many routes of this. And when the disease is high, nobody bothers about the adverse reaction, and the vaccine coverage increases, the disease comes down with increasing coverage, but some stop taking the vaccine. There is some loss of confidence because of the some adverse, because they all say that this had fever, this had this problem, and a lot of casual associations of the vaccine comes with these things, and then there is another outbreak. Till that resumption of confidence is there and the vaccination continues, only then you will get the eradication. So this is very important here, that our knowledge should be so precise that we should gain confidence into all and continue with the vaccination till we eradicate the disease. Well, undeniable success of the immunization program, decreasing the incidence of the serious disease that killed several children and caused lots of morbidity and mortalities in poliomyelitis, diphtheria, measles, smallpox. Particularly in the developed countries, there has been now more concern about vaccine safety, and the mass media, which sometimes highlights these uh, adverse events, and people lose the confidence in the vaccine. So the vaccine becomes victim of their own success. And why this comes, it's a lot to talk, but lots of religious, philosophical, political, emotional, and people sometimes don't like to be vaccinated. They just feel that probably the disease gives a better immunity, and lots of things come into play. Well, these stumbles are there, and some of them are real, some of them are uh, over highlighted. That we know that some in immunosuppressed, you can have a severe infection by the vaccine, but that's very, very rare. Paralysis occur with polio, but that's again very rare. And some diseases like Guillain-Barré, meningoencephalitis, these are all very rare. And even best was that Rota Shield vaccine when it came, when the association with interception, the vaccine was discontinued. And very rarely you get anaphylactic shock, and all of pediatrician and the vaccinologist must keep things ready to tackle these very, very rare problems so the patient get the best advantage. Well, we have seen the consequence of interrupting vaccination program. Pertussis vaccination, diphtheria vaccination, DPT was going very well, and introduction of this vaccine in 1940 and 1950, the disease started coming down, but then uh, because of the wholesale, some more reaction and some very rare reactions, people lost the confidence. In fact, some countries even stopped giving DPT, and then there was a resurgence of the disease until you had a acellular vaccine. This resurgence continued, and again, after the introduction of DPT into the national schedule in many countries like England, Wales, Nordic countries, Sweden, and Japan, the disease started to come down. Well, some of the programmatic errors are by which are uh, which can happen sometime. uh, Instead of diluent, in some rarely you have used insulin, wrong vaccine instead of hepatitis B, hepatitis A, instead of H influenza, hepatitis B. These all rare things. Now I will go through in this that you must follow the exact schedule, and you must check on all the small things and how this can be avoided. Unsterile syringes, wrong technique, vaccine into the sciatic nerve. So all these things are very, very important to avoid any hurdles and stumbles in the vaccination program. And these hurdles sometimes are overhyped by the mass media, and the confusion between the temporal and the causal association by the lay general public brings a lot of problem. And the lack of uh, these things are making some hurdles into these vaccines achievements. And a lot of people, uh, adverse events following vaccination, they think these are adverse reaction of the immunization. And these are the things which have been said in some, but none of them are absolutely true. And some sudden infant death, multiple sclerosis, autism, and MMR, these all things are very, very casually being associated, and nothing is important, scientifically proven, epidemiologically proven that these are wrong things, and this needs to be avoided in the success of the vaccination program. Pertussis, I already said, the lots of some countries stopped giving DPT, and then there was resurgence of pertussis till a better vaccine and more coverage. And the resurgence was not because of the imperfect DPT, it was because of no coverage beyond 5 and coverage of adolescent, pregnant, and adults. So DPT vaccination is given regularly during pregnancy, DTaP, to avoid pertussis in young children. And these are some of the highlights which we have observed by some of the effects which we can relate to. IAP schedule looks very, very good, very impressive, much better than before. We are giving the first year, three primary DPT, IPV, Hib, per, uh, pneumococcal, and rotavirus, with hepatitis B at birth and BCG at birth. And this hepatitis B at birth is very important because 50% of the cases of hepatitis B comes as a direct vertical transmission from mother to the baby, and this can only be avoided by screening all the pregnancies for hepatitis B, if not giving them the hepatitis B at birth as an additional dose, so making 4 doses instead of 3. And we can continue to give vaccination for MMR, pneumococcal, and as I mentioned, the boosters are very important. And here I want to highlight that as a clinician, as a pediatrician, as a vaccinologist, vaccination continues from birth till adulthood, till old age, till 80. So boosters are very important, and by the age of 60 plus, then there are many other vaccination which are very important. So covering for Tdap, chickenpox, hepatitis A, we will all go through this and importance of vaccination as recommended by the Indian Academy of Pediatrics. Missed vaccination puts the child at risk of contracting the disease the vaccine was meant to protect, because uh, sometimes these are delayed because parents are not available, or they can't go, or they miss the dates. So Indian Academy of Pediatrics recommend a very good catch-up vaccination for all. And if you have missed one dose out of the three, you don't have to repeat the whole course. You just need to add the third dose or the booster dose as recommended. And the catch up vaccination for all the following vaccine: the pneumococcal, inactivated polio, chickenpox, MMR, diphtheria, pertussis, hepatitis B, and special to mention about now, human papilloma virus infection, and which are now given to both males and females. And I hope very soon IAP will adopt this, or the Indian government will adopt this as a regular vaccine, because it is being practiced as a regular vaccine in almost all developed countries. So vaccination along with sanitation, clean drinking water, are the best cost effective public health interventions. Beside the sanitation and clean drinking water, the best cost effective uh, measures are by vaccination, and undeniably improves the global health. So don't skip immunization. Immunization start in infancy, continue to adulthood, and you must follow your pediatrician advice when it comes to childhood vaccination scheduled. If you miss the vaccination, catch up vaccination is there. Ideally, all should get the vaccination on time, for as recommended by our Indian Academy of Pediatrics. Well, I'm going to talk about some of the successes across the world and in India. WHO has given a very good recommendation on every single vaccine. The recommendation for pneumococcal is all those countries which have a childhood mortality under 5 or more than 50 should make pneumococcal vaccine as a priority. And by including pneumococcal vaccine into this national programs in various countries across US, England, Wales, Norway, France, you can see the reduction is anything from 70% to 89%, And in Norway, vaccination is almost compulsory, it's 100%. So, this substantial impact of the invasive pneumococcal disease in infant after introduction into the national program was highlighted for under 2 in real world, and these are the success which is from 70% to 100% by including. And once we have the PCV 15, PCV 20, probably you can talk about far more impact on the national program in reduction of the diseases. Not only that, once you add pneumococcal vaccine into the national schedule, the adults gets the herd effect. I'm not saying adults should not get a pneumococcal vaccine. As I mentioned, that in the extreme of the ages, our immune status goes down, our nutrition status goes down, so vaccines are important. But just by introducing a pneumococcal in children, the adult got the herd effect, and there was 25% reduction in overall IPD cases across 2000 to 2007 in Denmark, highlighting that the spread of infection to old people, to younger children, and other sometime occur through children. And this is very much true in influenza. Children don't suffer like the old people, they don't suffer like uh, they get over the disease, but children themselves carries the virus, and these viruses spread to the younger children, to other family member, and to other community. Similarly, program for influenza are done in UK highlighted the herd effect, that if all children in the school age group were vaccinated for influenza, then diseases in ILI, influenza like disease, across the areas where it was used reduced multifold. So, not only that, vaccination has a big advantage that if your child is ill, it misses the school days. And as I mentioned, the AMR, number of antibiotic use, is reduced by one third, and maternal and paternal work absenteeism gets reduced. So these ongoing program for influenza vaccination in children are not only effective in reducing the suffering in children, but also cost saving proposition, and very good for the employers that their uh, staff don't get ill so quickly. And a lot of staff, a lot of the employers offer these vaccines to their staff free, and so to avoid these absenteeism from the work. Another very important to highlight that the HPV virus is the necessary cause of 100% of the cervical cancer cases and 88% of the anal cancers and various other cancers. So, a lot of countries have included HPV in their national schedule, and children in the age of 9 to 15 are given this vaccine. Not only prevent the cancers, it prevents the pre-cancers and it prevents the genital warts. So these are all very, very important things which immunization has or can achieve, and various diseases like pneumococcal, rotavirus, and all these things are very, very important. I want to highlight here the anti-rabies vaccine, especially for our country. Most of the dogs are stray dogs. Children are unimmunized. Morning walkers are the victims of dog bite, and uh, pre-exposure prophylaxis is very helpful because you need less doses, and also you don't need immunoglobulins, which are sometimes very, very uh, difficult to get and has to be injected in the wound. And these all pre-exposure prophylaxis can avoid, and especially in children, the you get more bites on the face because children are height wise smaller, and the dog straight away goes to the face or the body instead of biting on the legs and hands. So very important issue for the anti rabies vaccine to be included, or which will help at least the avoid lots of post exposure prophylaxis, and schedules are very important. Some other diseases like the meningococcal, they spread very fast, and their progression is sometimes even less than few hours. And initial presentation can be very non-specific, like a simple viral fever, some headache, but it is very critical need of a diagnosis that you need to diagnose at least meningitis in a very quick fashion or avoid by your immunization program. And look at the immunization program across the developed countries has brought down meningococcal disease, and especially men C, men B have been tackled at a very, very good level by these uh, countries in Canada, USA, Brazil, Chile, Australia, UK. So these are all very, very important. And WHO straightway recommend the countries with intermediate to high endemic rate should adopt larger scale vaccination program, whereas country where the disease is less than 2 cases per 1 lakh should at least do the vaccination for the at risk, at the boarding school, lab workers, traveler to Hajj, and all children with immune deficiency should get these vaccinations. Well, I don't know why is typhoid vaccination and hepatitis A not a priority for a policy maker. The disease being a major public health in India, where you don't have a good supply of clean water and sanitation, and it is very important not only to provide good clean water and sanitation, but to give this vaccination to the community in total. As I said in the beginning, the last few slides, I'm going to highlight that when you give vaccination, which are of very good, high importance, that you should also be taking lot of precaution. Never mix in the same syringe two vaccine unless it is labeled to be mixed. Patient should be observed for any untoward allergic reaction at least 15 to 20 minutes after receiving, and all clinics where vaccine are given should have a facility for tackling such reaction with oxygen, adrenaline, atropine, and hydrocortisone. Two or more vaccine can be given the same visit, and this is our main thing at the moment, is that we multiple vaccine are given together and avoid unnecessary visits, because parents sometimes have to take their day off to come to get the vaccine, which sometimes they think is less important than missing their work. Vaccine should never be given onto the back near the sciatic nerve. It should always be given to the anterolateral aspect of the thigh or to the deltoid. These are the only two areas where IM injection should be used, and the use of combination vaccine is preferred because you can cover more diseases. Two or more live vaccine need to be separated at least 28 days. This rule does not apply to the live oral vaccine, and any interval can be kept between the live and the killed vaccine. The interval between two doses of the same vaccine should be 4 weeks, except rabies, which we do it much faster rate. and 037, 14, and 28. But for the inactivated vaccine, any interval can be kept. And a lot of parents have uh, one misconception that there is overload of vaccine in their body. Well, even wholesale DPT has so many antigen, and our body is able to handle lots of antigen together by their immune status. And the distance between the two injections should be at least 1 inch. Intramuscular should be given intramuscular at least to the depth of depending on the muscle mass into the muscle, at least 3/4 of an inch. And the schedule has to be followed, administered properly. Any vaccine which is administered 4 days prior to the minimum interval should be regarded as a uh, no zero dose, and previous immunization should be checked, and catch up vaccination should be done, and person should be immunized appropriately for age. Worth mentioning here that the healthcare workers, all healthcare workers must receive DPT, flu, typhoid, pneumococcal, MMR, varicella, hepatitis B, and meningococcal vaccine, because as a clinician we can get this disease from patient, and if we are immunized we should not be spreading it to the patient. And we also have a important for our family, because we should not bring infection back to our home and spread it to our children or our parents. So health of all is important. We must take necessary vaccine. These are some of the projected vaccine coming in the pipeline. We are waiting to see vaccine for various other diseases. Dengue is coming very, very shortly, being used in some countries. HIV, AIDS vaccine, these all are pipeline, and a lot of research is going in developing these vaccine. This is very important slide. There is a one drop of water on the leaf. It is being balanced by 12 ants in 4 groups. And this, any ant which comes back or moves his space, the drop of the water will fall. So we need a very, very important doctor, patient, public, government uh, uh, together, that we should give the benefit of that one small drop of vaccine to the children, to the adults, and to the whole community. And this balance between all of them is very important for the success of the vaccination. And last slide, there are so many benefits. Avoiding infection, remaining disease free, comes at a very minimal risk or a minute risk, as small as even a rat or a small insect, that these adverse reactions, which are usually very mild, the balance of the risk and the benefit must be weighed heavily towards the side of the benefit. And the immunization program have saved countries from a lot of miseries, morbidity, mortality, disability, and it is very important that we should give vaccination program the best we can offer. Thank you.
Uh, Dr. Narang, thank you so much for the presentation. And we will now open the forum for the question answers. I welcome Dr. Chong, the chair for the session, and the chair for CMAAO. Dr. Chong, over to you.
Thank you, Sarab. Thank you, Dr. Parvinder. It was a wonderful presentation. I came about halfway, but I think it's very important to always emphasize vaccinations, especially after COVID. We've had a
Yeah.
whole wave of viruses trying to come back and reclaim the space that COVID left left them behind. So
Absolutely.
yeah, we in Singapore, for example, we have a huge drive right now for pneumococcal vaccine,
Yeah.
shingles vaccines, and of course the childhood vaccines are all mandatory. But always a good timely lecture to remind us of how important vaccinations are, especially with dubious leadership now from the United States, CDC. I'm
Yeah.
sorry, Monica. Thank you very much, Dr. Parvinder, for your
Hmm.
lecture.
Yeah, we should all the information we give, and a lot of time it is very important to tell the parents that you have taken your own vaccination. I have worked for many years in UK, and not only vaccination is important for doctors, their immune titers are also very, very important. That especially working in the bone marrow transplant unit, it is very important not only you have taken the vaccine, it has worked on your body and you have enough titer so that you don't give infection to your patients, because once they are immunocompromised, they lose their immunity and get serious infections.
Yes, Dr. Parvinder, it's quite sad to see, for example, outbreaks in big cities for example, in Europe or in US because a huge number of um, people have decided against vaccinations for their children. I mean, it's quite sad to see this sort of things happening.
Yeah,
Uh,
that's really important. I mean, it is very, very disheartening because
yeah.
when it comes and especially they get infection, it is very disheartening to see that.
During COVID, our Singapore government was very militant about people who are anti-vax, and of course, a lot of people complained, but it was the way to go. They were very militant. They took people to task, jailed them, everything, the whole lot, fined them, jailed them. Was
No,
zero
I agree.
tolerance.
I mean, in when I was talking about the success of the pneumococcal vaccine in the Nordic countries, you could see that in Norway and so on, the success was almost 100%.
Yeah.
And I mean, I've been to Singapore and I know what how good Singapore health system is, and worth to, as you mentioned, that you made every attempt. And as I showed the last slide where a drop of water is on the leaf,
Yeah.
and if there is any imbalance on that, either from the patient side or from the doctor side or from the government side, or any rules are broken and so on, the drop will fall. So, and as I right from the beginning, I said vaccines are lying in the fridge, and once it is given, that is called vaccination.
Yeah. So even there was a group of anti-vax doctors that were really taken to task by the government. The government
Yeah,
just took them on, and yeah, and
yeah.
there was recently there's a case now going to trial of a doctor who had helped this group of anti-vaxxers and given them saline shots and certified that they had received vaccination.
Oh my God,
Yeah, and
very bad, very
and
bad.
he's gone to trial. He's claimed trial, but I think
Hmm.
they're probably ending up jailing him.
Yeah.
Because yeah,
See, when I received my first COVID vaccine, uh, being in the healthcare system, we were offered the COVID vaccine.
yes,
And right in the beginning, very few people came to take it because they didn't have the confidence. And as soon as I came out of the vaccination, and everybody who used to ring me and say, "Have you had your vaccination?" I said, "Yes." "Are you all right?" I said, "I'm fine." "I'm all right because of the vaccination."
I recall getting my first Pfizer jab in January of 2021, and that was like within a year of the outbreak.
Hmm.
I mean,
No,
it's
I
amazing.
as soon as the immunization program started in India, I received my first dose within the 7 days,
Yep.
uh, uh, and that was the confidence which you have to believe in your healthcare.
Yeah.
So it's very important, and we have seen lots of success, but the programmatic error should be always avoided, because this programmatic error has happened sometime in the national program, like
Yeah.
hepatitis uh, B not given and Hib used instead of that for a long time.
Mm.
And then it was found that people were given Hib instead of hepatitis B. So these programmatic errors are obviously very, very few, but it's very important. The technique of vaccination is very important. Giving the intramuscular injection not properly will have a nodule formation, will have a more pain, and the people will lose confidence into the vaccination program.
Yes.
So these techniques are very important.
Historically, very interesting. Singapore was the first one of the first countries in the world to start hepatitis B vaccine for babies. In 1987, we were one of the first, and also historically, very interesting. We were one of the first countries in the world to do the polio vaccine in the 1950s. I think it's
Yeah.
the oral,
Yes.
the Sabine.
Yeah.
We were one of the
Yeah,
first
that's right.
countries in the world. Yeah,
Yeah, very good, sir. I mean,
yeah. So
people have to learn from your examples, but we
yeah,
have a very big population.
I
But at the
understand.
same time,
Different
we,
scale. Different
yeah,
scale. Our small city, we are a small city. You guys are a giant continent. So different scale, different scale.
but these efforts are very important in the giants.
Yeah. Monica, sorry about the little dig. Any comments?
Oh, well, first of all, I have to thank Dr. Narang for like doing this at 5 in the morning because he's in the UK. So for those of us, this is not normal time. And I think that this is always, I think we have to go back to common sense, and we have to come back and remind everybody about the benefits of immunizations. And I think you did an amazing job. But I want to highlight that when we counsel our patients, sure, there's, the public health agencies, sure, there's your local, like regional, national, regional, local approach to what the immunization schedule is. But every immunization is a conversation between a physician and a patient.
Yeah,
And the physician and the patient takes it to a personal level where your physician says, I know you, I know your health, I know your history, I know your risk factors. And fine, this is what you're seeing, but let's talk about this in context of you, and let's talk about the alternatives. And sometimes when patients tell me that that they've already have natural immunity, they've had infections. Pneumococcal is a great example, right? Because we can get serotypes to the capsular antigens. And so we can numerically quantify how many antigens and how much of the IgG protective antibodies they have to the capsular pneumococcal antigens to demonstrate that, look, you will benefit from immunizations. So I'm glad that you brought up the concept of serologies, because I think that it's going to take very creative, thoughtful, dynamic approaches and interactions with our patients for those who are showing skepticism. And to say that, this is an asymmetrical relationship. You're coming to me for advice on how to treat you and how to make you healthier. And this is part of the conversation. Maybe you're not ready to hear it, but let's still have a conversation about it, because I'd rather you hear it from me than to hear it from Facebook or to hear it from another social media or your neighbor, etc. So I greatly appreciate the topic, and I greatly appreciate your presentation.
thank you, Monica.
So,
Any comments from the floor?
do we have any other questions on the floor? There's one question which we have for the children. What vaccinations are required for children with chronic conditions and low immunity?
Saurabh, that is a very, very important question. Rather, I would say with children with immunocompromised or lower immunity should be given vaccine as a preferential. Okay. there is a possibility that they may develop less immunity, but it hardly matters because they are more prone to infection. Only with the children with a very low CD count, the live vaccine can be given with caution or cannot be given depending on the CD count. But all killed vaccine are can be easily administered, and these are the situation because these children will may get less immunity but still will get enough as a protection. And as I said, uh, we have seen that in uh, developing countries all oral vaccines behave less as compared to other countries, developed countries, but still polio vaccine oral, rota vaccine oral, even with 50% benefit as compared to developed countries, gives a very good total overall reaction, overall benefits, and good herd immunity comes. So, even if one theoretical presumption that you are going to get less, it is still important to give the vaccine in such children, and that is very very important. Only with CD count of very low, which your doctor will tell you, some live vaccine cannot be given, but others all can be given.
Okay, and in some cases, kids do have fever after vaccination. How can you tackle that fever?
Okay, simple is that how uncomfortable the child is. There are two school of thoughts. Some countries practice the first school of thought that they give paracetamol before the vaccination, and some use it after the vaccination. I prefer to use it after the vaccination if required. So paracetamol dose can be given after the vaccination if the child has some pain, some fever, to make her more comfortable. Uh, these are the things which you can prepare the parent that these are the vaccinations will have. And some of the parents sometimes feel that unless the fever comes, their vaccine hasn't been taken. Untrue. Some vaccines do not cause fever, such as uh, chickenpox or MMR, less as compared to DPT. But simple to tackle is they should have a paracetamol handy. They should know according to the weight the dose which is required and can be administered. And if they are very very panicky about it, it can be given prior to the vaccination or after the vaccination.
Sir, as we all know, that COVID is spreading in India. Any
Hmm.
take for COVID?
Once again, here I think uh, children, even today in India, are not vaccinated because we started the program for children. We started with adults, we came down to around 12, then we had a vaccine for 5 to 12, and then this program fizzled out because the COVID came down. And now, when the COVID is coming back, it is important to bring this immunization program back. And boosters are also required for those who have taken the vaccine. Boosters are also required for adults who have taken the vaccine. And as I said, if you look at the vicious cycle, the children are, they themselves don't suffer as much as the adults or the old people can, but they carry the virus. Especially, it is well proven for influenza and COVID, they carry the virus because uh, then they bring the disease. So, vaccination of children is very important. At the moment, we should do the catch up as well as the full blown vaccination for COVID.
Good morning, Dr. Pravinder. Excellent update on the vaccination. This is Dr. Hussain from South Africa.
All right.
I have
Okay.
few in South Africa. I will share. We started a program in 1990 by 2030.
Hmm.
So we like to make sure coverage of vaccine, HIV status, and testing TB. By 2030, we need to cover all 90% of the population, and especially immunization. We want a polio-free, measles-free. But the problem now and then we get epidemic or spring out in pocket wise. Some of those children or family go through the crack and then spread. And there are again, you mentioned that religious and belief and all. I
Hmm.
just wanted to know, is there any vaccine got a ingredients of pig serum or any other ingredient except bovine? Because some people in Africa, they don't want to take vaccine. Even they want to kill the vacciner, the health worker. So that's the one. The second thing I just need is some clarity. Immunization program, we do birth and 6 weeks, 10 weeks, and 14 weeks.
Hmm.
Some other country got different schedule.
Yeah.
So what is the difference? Why
Okay.
why not is the universal? Thank you.
Okay. Yeah. It is. See, we have a priority of covering. I mean, South Africa as well as India. I know the schedule is 6, 10, 14. The you may get a less response if you are comparing with 246, because 2 months gap for 3 DPT is considered ideal. But it doesn't mean that I switch on to 246 in my country, because the number of infections are more and I need to cover it. As I mentioned, the oral vaccines have a lesser response in developing countries as compared to developed countries, maybe because of the overburden of the gut flora with some pathogens, and still mass usage of any vaccine. And when I say mass usage of any vaccine, when it goes above 80%, you get the herd immunity. So completing the course early in places where infection rate is high, completing another thing which is cocoon theory, that completing the protection in the whole environment. If you have an immunocompromised child, I will be concentrating on vaccinating adults in the family so that this child doesn't get, or vice versa. If adults are immunocompromised, I'll concentrate on vaccinating others in the family. So the schedule are decided according to the burden of the disease, and sometimes hepatitis B is given as a double dose when you need to get the immunity faster. In old people also, influenza can be given double dose to get the immunity or get the sufficient titer faster. So these are all important, and the policy making persons, the epidemiologists, decide on that thing which is best for the country. So not necessarily 246 is ideal for my country, because we have to control the infection, or we have to make our child more protected earlier than what can be left to get the infection.
So, just last couple of questions I have here, if nobody else has a question. A combination of vaccinations and drugs, I believe it's more common in like Asian countries, less common in northern part of US or something. What is recommended? The combination of vaccinations for children are recommended or not?
Definitely, combined vaccine are recommended for children, because, say for example, in the primary series, the DPT, rotavirus, pneumococcal, you are covering 6 diseases: diphtheria, pertussis, tetanus, Hib, hepatitis B, and polio. and you're covering pneumococcal and also rotavirus. So combination is precisely, as I said, body can handle many antigens together. It's not that one antigen given that for the second antigen you have to wait. All it can be given simultaneously. More than two vaccines can be given together, and our main importance is to control the disease. And as I mentioned, the vaccination of the prenatal, the vaccination of the antenatal, it's very important to protect small babies from getting pertussis, influenza, and RSV. So you have a window period of 2 months. Say the vaccine is given at 6 weeks, another 3 4 weeks are required for the immunity to develop. So you have a window period of 2 to 3 months. In that window period, the passive immunity from the mother, the protective immunity from the family are very important to avoid these infections.
I have a question. I'm Dr. Kiran. I want to just clarify more about pre-exposure rabies vaccine. How to take it, what age to be taken, and
Okay, those who are keeping dogs in their home, those who are working in the lab, they should be taking pre-exposure vaccine. And currently, the schedule we follow in India is 3 doses given at 0, 7, and 21 days. 21 can be made to 28 days, but 0, 7, 21 are the 3 doses. And Dr. Kiran, the benefit of this is, say this person gets the uh, bite, then we don't have to give immunoglobulins or rabies shield. We only have to give two more injection at 0 and 3 on the day of the bite and the third day of the bite. So pre-exposure prophylaxis works quite well for those who have pets at home. And in India, the problem with the pre-exposure is also justified because the whole population of the dogs is primarily 90% are the stray dogs, and the stray dogs are not vaccinated, or if vaccinated, you don't know the exact status of them.
so you mean to say all morning walkers should take this pre-exposure?
Yes,
Because
they should be.
it's very
They should
common
be.
here, when you're walking, the dog
Well,
bites are very common.
I mean, whatever I do, I first practice on myself. I have taken the pre-exposure vaccine because I used to do, I mean, I'm still doing exercises, but I used to do morning cycling. And my experience was when you're cycling for the 200 meter, a set of dogs follow you. After 200 meter, another set of dogs follow you. So they have their area divided, and every time they are following you, you have a fear in your mind uh, that this is going to happen. So
But once
I'm
you have taken post-exposure vaccination, then how much gap you need, for the next vaccination?
okay. Uh, See, in rabies vaccine, even if you are immune, you take the vaccine, because in rabies vaccine I use one liner that rabies is 100% fatal, but 100% can be protected by vaccination. So one liner is rabies can be prevented 100% by vaccination, but if you get the disease, 100% fatal. So within 1 year of taking the vaccine, you get the bite. You may not need, but 0 and 3 is definitely given if 6 months have elapsed between your pre-exposure and the bite.
So,
Uh,
thank you.
So, I think we might have more questions, but I think in the interest of time and I would say strength of the presenter, we would like to close the session. I think if that's okay with everyone.
Saurabh sir,
Yes.
whether we are having recordings of these presentations?
Yeah, we will. I will share the recording. We have all these recordings are live on social media, probably more than 5 platforms on Facebook.
Please send down the
You
group.
share the presentation. So I think I would like Dr. Chong to close this session, and thanks, Dr. Narang.
Okay.
Thank you, Dr. Narang, for your wonderful presentation on vaccination. I think it's a timely reminder of this is a very important topic. One of the foundation stones of all healthcare systems is vaccination. So something we always tend to overlook and forget. But it's a timely reminder, and always good to hear from an authority like your good self. So thank you very much again. And without much further ado, and I know it's quite early there in the morning. So thank you again, and we hope to see you again.
Thank you. Thank you, Dr. Chong.
Okay. Bye.
Thank you, Dr. Narang, for the wonderful presentation.
Yes.
And goodbye to all our viewers. See you again next session. Thank you.
Thank you.
Thank you. Bye.